Okay. I'm Amy Johnson. I'm the policy coordinator for the Wisconsin Comprehensive Cancer Control Program. We staff and facilitate the Wisconsin Cancer Council, our state's diverse cancer control coalition. Also on the phone with me today is H.J. Waukau. He's the chair of the Wisconsin Cancer Council's Policy Committee and the Advocacy and Regulatory Affairs Manager with the Wisconsin Medical Society. The topic of our call, here we go, is cancer policy and the state budget and legislation. And this will be an overview with discussion of the issues and legislation we monitor. HJ has graciously stepped in to give the presentation on the budget and legislation, and I'll be the moderator for the call. Our webinar will include a brief description of the Wisconsin Cancer Council's Policy Committee, an overview of the biennial budget for the state legislative updates, and Q&A video. Okay. First of all, we'd like to start off with a few questions. Is your organization or position directly impacted by this budget? Meaning, does your office or position depend on or receive funding from the state that was included in this budget? Please answer yes or no. Oh, we're having trouble with our polling. Give us one quick second if you don't mind. Or you could also use the chat box. Use the chat box, please. Okay. All right. Anybody else? All right. Okay. Thank you. All right. Next question. If you follow, and this might be a little more difficult to do, but if you follow the budget process or continue to monitor legislation coming from the state legislature, which resources do you use? Do you use newspaper or radio, alerts from advocacy organizations, Wisconsin Cancer Council updates or other, or you haven't followed the budget or legislative process? It might be, I could see how you might be a little sheepish about saying you don't follow it if you're on a policy call. So just, if you want to just weigh in and say one of those, that'd be good. Okay. Okay, great. Thank you. We'll have more questions for you later in the presentation, and we'll just use the chat box to make it easier. So before we dive into budget and legislation, I want to briefly discuss our policy work and the Wisconsin Cancer Council's Policy Committee. When looking at policy through the lens of policy, systems, and environmental change, policy is often defined as interventions or actions that amend laws, ordinances, mandates, rules, or regulations. And examples include taxes on tobacco products, tanning bed rules, and rules and laws and building codes. Policy happens on the federal level, the state level, and local. Important fact that needs to be mentioned is that the Wisconsin Cancer Council and its policy committee cannot lobby our local, state, or federal officials, or we can't lead grassroots efforts. We instead serve as an educational resource on cancer policy for our members and government officials. For example, the issue briefs produced by the Wisconsin Comprehensive Cancer Control Program include a section on policy implications that explain the impact of legislation or the need for certain provisions in legislative proposals. You can find our issue briefs on the wisconsincancer.org website under Cancer Control Resources. The policy implication sections are typically provided towards the end of the documents. We continue to produce the issue briefs, and currently we're working on one on medical marijuana that explains medical marijuana and considerations for lawmakers in crafting a bill to legalize it, which you may have heard is being considered, and HJ will discuss that a little bit more. Okay, a next question, and again, use the chat box. What is your organization doing related to policy work on the local, statewide, or federal levels? You could also, just to make it easy, maybe you can unmute your UW's one. Okay. We got comments from Noel and from HJ. And from Deborah. I'll also mention that if you want to tell me more about what you're doing or just kind of share some ideas, feel free to contact me by email at amjohnson, JOHNSON, 39 at wisc.edu. Okay, thank you, Linda. And from Jessica, too. Okay. I'll now turn it over to H.J. Waukau, our Policy Committee Chair.
Am I on?
You are on.
All right. Good morning, everyone, and thank you for taking the time to be on the webinar today. I know this is an issue that a lot of you care deeply about, or at least the policy implications of the various things that the Wisconsin Cancer Council does, along with this policy committee. And this webinar is designed to serve as an update, kind of give you a good feel for the issues that we follow, the issues that that we track. Both here in the state and then at the federal level, in terms of both whether it be budget or legislative items or anything else. So thank you again for taking the time, and we'll get started here. So just to kind of start off, the Wisconsin Cancer Council's Policy Committee is a unique group of more than 20 healthcare providers, policy experts, and government relations professionals that meet quarterly to discuss legislation, regulations, and policy initiatives by healthcare and patient advocates. After each of our meetings, the staff of the Comprehensive Cancer Control Program produced a resource called the Roundup or the Policy Roundup. And this highlights the topics that we discuss within our quarterly meetings, as well as provides information on issues pending in the government. And that could be at the state level, that could be at the federal level, or otherwise as those policy issues arise. In addition to our quarterly meetings in February, members of the Policy Committee and staff of the Wisconsin Comprehensive Cancer Control Program got together and delivered an overview of materials of the work of the Wisconsin Cancer Council to all state legislative offices as a part of our annual legislative drop. And this is something that we've been doing for a couple of years now, where we all get together at the Capitol. It's usually a little chilly, and we go from office to office. We hit every state office, all 132 of them, and drop them off a packet of materials. This is also, along with that, a chance to introduce ourselves as both as the policy committee and as the Cancer Council. Offers us a chance to introduce ourselves to legislators and their staff and serve as a direct resource on cancer policy. As the policy committee and the Cancer Council, we cannot engage in direct advocacy on behalf of the Cancer Council. That's part of some of our restrictions due to funding and some of the legal issues. But we are definitely allowed to be a resource and put information out there and serve as a resource for these entities, and that's what we do here. Included in our materials that we had in our legislative drop, we had county statistics for each legislator's district, as well as fact sheets on the HPV vaccine, links between alcohol consumption and cancer, as well as an issue brief that was on the utility of a palliative care advisory panel. If you would like to see some of those fact sheets or what those look like, or want a copy of that memo, please reach out to Amy Johnson and Sarah Kirch, and we'll be happy to provide you that information. You can also visit the Member Resources tab on the link that you see there on your screen to get access to those materials. There we go to the next slide here. There we go. So our policy agenda for the next 2 years, for 2018 to 2020, is what you can see in front of you, and these are the 5 initiatives, 5 goals that we are looking to address, both within our policy initiative and on the policy committee. The current policy agenda for the committee includes, the goals and checklists you have out there, as well, and these are designed to be in support of the council's action plan, along with the statewide comprehensive cancer control program. Regarding those 5 goals which you see before you, the first goal is creating environments that discourage excessive alcohol use. And efforts around this include promoting policies and practices that reduce excessive alcohol use by impacting alcohol affordability, availability, acceptability, and attractiveness, while also protecting and strengthening policies and programs that reduce underage drinking. For our second one, we want to maximize access to the HPV vaccine by removing both patient and provider barriers. This includes supporting effective implementation of existing policies and programs that provide the HPV vaccine at low or at no cost to patients. Examples of this include the Affordable Care Act, the Vaccines for Children program, many other vaccine programs that support this effort. We also want to increase the quality, availability, and effective use of health insurance coverage for cancer prevention, screening, and treatment. This includes protecting and expanding policies and programs that provide affordable cancer prevention, screening, and treatment, and services. And a great example of this is the Wisconsin Well Woman program. We also want to support partner policy efforts to limit limit youth access to e-cigarettes and other tobacco programs, and I think we can extend that to access overall. And we monitor emerging policy issues that impact youth access to these products, and this is a very active topic right now. This is getting a lot of attention, both at the local level here in Wisconsin as well as at the national level, and we'll get to that here in a little bit more detail. And lastly, we want to support initiatives that advance quality cancer care, and a lot of this revolves a lot of collaboration between our partners and members with the cancer program, cancer control program, and including promoting partner initiatives on issues. And a great example of this, of a great collaborative issue, is the statewide Palliative Care Council, and we'll get to that in a little bit more detail. If you want to learn more about this agenda or what we're doing on it, please click on the link at wisconsincancer.org and provide it in the slide at the Cancer Council/policy. All right, so to start off, within the most recent time frame, the biggest policy item that affects so many people is the biennial budget, the 2019-2021 biennial budget that's put forward by Governor Evers and voted on by the legislature and then vetoed, or some of those items were vetoed by Governor Evers. But that's the biggest item that we deal with any given policy session. So when you have at the beginning of the biennium, it kind of sucks up all the oxygen in the room. It takes everyone's focus, and there's really it's a hard time to really move legislation that doesn't have a direct relation either to the budget or doesn't have overwhelming support of both the legislature and the governor. So this is going to be a little focused on the budget, but that's a good thing. And if you have any questions, please, when we get to that, we'll happily take those questions. So back in February, the governor released his budget blueprint, and one of the signature items within the budget that had a huge impact for a lot of programs, particularly healthcare programs and cancer-related programs, was the expansion of Medicaid, which would have extended coverage to more than 80,000 adults, and I should point out those would be childless adults, with incomes up to 138% of the federal poverty level. The governor's budget also proposed eliminating the existing monthly premiums, work requirements, copays, and health risk assessments for childless adults that had been previously approved under Governor Walker under the renewed 1115 Medicaid demonstration waiver that was approved by CMS right before the election. In addition to covering more adults, the expansion was estimated to generate $324 million in budget savings that would have been applied to health care along with the Wisconsin Medicaid program. The governor proposed that a portion of those savings be used to support and increase funding for existing programs. And the key point of the governor's budget was that all of these savings wouldn't be then spent on other items within the budget. So for things like roads or schools, but all of those savings that would have come from the Medicaid expansion would have gone back into health care into some way, shape, or form. The governor's budget also called for additional $6.6 million over a 2-year period for tobacco cessation programs. It included a 71% tax on vaping fluid and devices. It had a medical marijuana provision in there for patients with debilitating conditions. It also had an additional $200,000 over a 2-year period for the Wisconsin Well Women Program, which offers mammograms, Pap tests, cervical cancer screenings for women between the ages of 45 and 64 who have little or no health insurance coverage. The governor also included a $15 million allocation for the Medical College of Wisconsin to build a new cancer research facility. Wanted to include that in there as well. But once the governor put his budget out there, the budget then goes to the Joint Committee on Finance, and to make things even a little bit more confusing, the colloquial term for this program is the JFC, even though it technically should be JCF, but everyone just calls it the JFC. And the JFC is responsible for really putting the governor's budget into action. And it's a 16-member committee that is made up of 6 members from both the House and, from the Assembly and the Senate. And given the current makeup of both the Assembly and the Senate, it includes 12 Republicans and 4 Democrats. The JFC held 6 listening sessions around the state, beginning in April on the governor's budget proposal, and then began marking up their budget in May, their version of the budget in May. And it's key to point out that whenever the JFC gets together, they do use the governor's budget as sort of the model or the blueprint for what they want to do going forward. So it's always a good indication of where things are headed. But one of the first things the JFC did was it dropped the legalization of medical marijuana from the governor's budget, as well as the Medicaid expansion proposal that would have eliminated cost sharing and work requirements for Medicaid beneficiaries, along with just the entirety of the Medicaid expansion. And that had a very large and significant effect on what the Joint Finance Committee could do in terms of savings, expenditures, and the like for healthcare programs. And a lot of it is due to the diminished savings that would not be able to do that $324 million. Also dropped was the $6.6 million for tobacco cessation, as well as the tax on the 71% on fluids for devices. That tax was dropped to a 5-cent per milliliter tax on vaping fluid oil only, and that's what the JFC came up. They also downsized the appropriation for the Medical College of Wisconsin to $10 million, down from $15 million. At the end of June, after they got the Joint Finance budget, the Assembly and Senate approved the JFC's final product with some small revisions, and then sent it over to the governor for his consideration. It was kind of an interesting time because people weren't sure if the governor was going to veto the budget outright and may restart the whole process, or if he was going to heavily veto it. One of the reasons that maybe prohibited him from a full-on budget veto, other than the fact that it would have been completely unprecedented by governor, was the fact that the legislature said they would not be back until sometime in October to vote on a new budget bill, and that would have dragged the process out most likely into January at least, and into the 2020 election. So everyone wanted to avoid that as much as possible. In the end, the governor wound up using about 78 different line item vetoes, and the governor of Wisconsin has one of the most powerful veto pens in the country. It allows him to strike out single words, to strike out numbers, and some of those changes can, completely alter and change what a final budget looks like. So in the end, you wound up with a budget that was about a little bit shy of about $82 billion over the next biennium, with about $41.4 billion for the 2019 to 2020 biennium, and $41.5 billion for the 2020 to 2021 biennium. Not surprisingly, as happens almost every budget, the biggest chunks go to things like Medicaid and Department of Health Services, goes to schools for DPI, the UW system, transportation, Department of Administration, Department of Children and Families, as well as the Department of Corrections. Perhaps the biggest newsworthy item within the governor's budget was the fact that he was able to use his line item veto to generate a $65 million increase, or $65 million more than what the legislature had passed. And normally, and that was kind of interesting because normally you see governors use the veto pen to reduce spending or to kind of rein in how much money is being allocated to certain programs. And in my experience, Governor Ewers was the first one that used that pen to get more money out of the budget. And he did that by increasing the per pupil aid by $63 a year and line iteming the language that limited the increase for a certain term or for a certain year, effectively making that increase permanent. So that was kind of interesting on how that all happened, and that was kind of creative on his part. Also, you saw a $500 million tax cut, income tax cut. That was another big item that got a lot of news and a lot of press. Regarding the impacts that it had, more for healthcare as well as for more cancer-related items, ultimately there was a 5-cent tax per milliliter of vaping fluid, and that adds up to a 3.5 cents per joule pod is what that tax comes out to. Now, it's worth pointing out that some people, some healthcare advocated that Governor Evers veto that provision in his budget wholesale, not because they weren't supportive of his tax on vaping or Juul pods, but they felt that the tax that the JFC passed was too weak and ineffective. But ultimately, the governor decided not to go with that and wound up keeping the tax. Also, within the budget, you saw that the Medicaid work requirements and cost-sharing requirements were also maintained. A lot of it had to do with the approved waiver from CMS for the 1115 waiver. Also saw $200,000 over a 2-year period for the Wisconsin Wellman Program, including a 5% funding increase for health screening services. And also maintenance of a $10 million allocation for the Medical College of Wisconsin for a new cancer research facility. Click on the next one here. So that was the budget, and with the budget moving forward, so now all the funding and all the programs can keep operating as they normally would. Not a whole lot of surprises otherwise, but there are a lot of other legislative items that we are tracking, and that we are, that the members of the policy committee and of the Cancer Council and the steering committee are actively engaged in and monitoring as well. So now that we've moved past the budget, the legislature is directing its attention towards other legislation, with all the policy committees working on proposals in the hopes of passing their bills during the floor sessions either this fall or in early spring, and we're anticipating that after the early spring session, whether that's in February or March, the legislature is going to kind of shut her down for the year and go into full-blown campaign mode for the 2020 election, not unlike they did in 2018, so that's not unexpected. There may be a special joint emergency session that can happen within an election year, but it is yet to see if that will happen or what that issue would be. So there's a lot of energy to get things done in the near term, knowing that the legislature is not going to be in session much in 2020. But in terms of the big legislative proposals that we're looking at following, the biggest one is probably the bipartisan proposal to establish a palliative care council within the state DHS, and that bill has garnered 30 different co-sponsors. It's fairly bipartisan. For those of you looking to figure out and see the exact language of the bill, those are Assembly Bill AB 24 and Senate Bill 225. Those bills have been assigned to the Mental Health and Health and Human Services committees, respectively, in each chamber of the legislature. If approved, the bill would wind up creating a panel of experts that would study the state's palliative care landscape and recommend ways to improve and expand access to palliative care throughout Wisconsin. This is a bill that was a similar bill that was proposed last session and wound up being amended after a study committee recommended changes last summer and was reintroduced this session. Moving on, Senate and Assembly Democrats have also introduced a Medicaid expansion bill a couple weeks ago. The bill is SB 361. Essentially what the bill does is it includes the governor's language for a Medicaid expansion. However, it does include the work requirements and the cost-sharing provisions that have been approved by the demonstration waiver. And that was the key thing that was missing from the governor's budget language. And that's interesting because that when you see states that are controlled by either GOP legislatures or GOP governors, those states that have accepted the expansion have done so with some form of work requirements or some form of cost sharing. It'd be interesting to see whether or not that moves forward this session through the legislature, but it's something that's worth tracking. As of right now, no Republicans have signed onto the bill, and every Democrat in both the Assembly and in the Senate have signed onto the bill. Also kind of gathering some attention in big-ticket items, Assembly Speaker Voss has signaled his interest to introduce and evaluate a standalone medical marijuana bill, which is interesting given that the governor had a medical marijuana provision in his budget, but that was pulled out by the JFC. The speaker stated that the governor's budget provision went too far towards allowing recreational use of marijuana, which because it would have permitted people to possess less than 25 grams for personal use and created an expungent procedure for those with convictions for possession, manufacture, or distribution of marijuana of less than 25 grams. Recreational marijuana legislation has also been introduced in the Assembly and the Senate, and both of those, along with introducing a full legalization, will also allow for medical marijuana. But those have not really gotten much movement in the legislature. Now, today it's worth pointing out, even though Speaker Voss has signaled his intent to have something in the Assembly, no bill has yet been drafted, and that may have something to do with the fact that Senator Fitzgerald has indicated that he will not support any form of medical marijuana within the Senate chamber. Again, this can all change if there are some revisions that get included in the bill or if attitudes amongst the caucus change, but right now that's kind of where things stand with the medical concerns to medical marijuana. There's also recently, and this just came out last week, that there's an Assembly resolution that is being circulated for co-sponsors that would designate September 2019 and September 2020 as Ovarian Cancer Awareness Month. The resolution states that ovarian cancer ranks 10th in rates of new cancer cases, but 5th among cancer deaths for women. It also states that there's an urgent need to develop preventive strategies, early detection tools, and better therapies for patients. And that's something that just came out last week and something that we are tracking and monitoring as well. Lastly, a couple of the big items that are have kind of popped up to the fore, given a lot of stories in the press and a lot of concerns both locally and nationally. Bills related to youth use of tobacco, more specifically vaping, and there are two bills, or actually I should say one bill that would raise the smoking age or the ability to buy or acquire tobacco to 21, and a couple of other bills that would look at adding vaping to the state's indoor air laws. But the Tobacco 21 bill is SB 364, and it was introduced in late August and had bipartisan support with 12 senators and 31 representatives signing on. The bill changes the age for purchasing cigarettes, tobacco products, or nicotine products to 21 years old, and also imposes a minimum age for purchasing of vapor products, which then are defined as non-combustible products that produce a vapor or aerosol for inhalation from the application of a heating element, regardless of whether or not the liquid or substance contains nicotine. However, the bill does not contain language regarding licensure for vape shops, which makes the enforcement of this provision a little bit difficult. The bill in its present form also does not include any sort of preemption or fines on youth or any sort of military exemption. Regarding the bills on the Clean Indoor Air Act, these bills would add e-cigarettes and other vaping products to the state's indoor air laws. Currently, the state smoking ban prohibits the use of cigarettes, cigars, and other tobacco products indoors, but it does not apply to vaping products. However, governments in Wisconsin are allowed to regulate vaping in their own jurisdictions, and a number of local municipalities have done so. However, at the present moment, the bill lacks bipartisan support, and the current outlook is uncertain. I also kind of want to add onto this is that you're starting to see at the national level efforts to ban or eliminate the sale of flavored vape products. San Francisco has outlawed this or has banned the sale of flavored vape products. The governor of Michigan is working on creating an emergency rule that would ban the sale of flavored vape products. And then just yesterday, President Trump signaled his intent to pass to have an executive action and then an administrative rule that would ban the sale of flavored vaping products or e-cigarettes. So this is something that has gathered a lot of attention, the focus being on youth use, particularly among high school kids, and the increasing use of vaping from over the last couple of years amongst that population, which is interesting because youth smoking of cigarettes, traditional tobacco products, has been going down steadily since the 80s and 90s. So with that, we'd like to wrap up our legislative update, our policy update, and we are happy to answer any questions that you may have. And I'll kick it back over to Amy for moderating and questions.
Thanks, HJ. Anybody have questions? You could unmute your line by pressing #6. Or type them into the chat box.
Give everybody a minute here.
You're pretty thorough.
I would like to think so, but I'd hope I think there'd be one or two questions.
There we go.
Wow, very thorough. So happy to answer questions. Again, the policy committee, it meets. We meet 4 times a year. We meet quarterly, and the meetings are. For those that are on that and have been those, they're very robust, and the topics that we talk about are always very timely. They always generate a lot of discussion, and the folks that attend are very well versed and very informed on not just on the broad issues of the day, but a lot of the nuances and the particulars as it comes to not just the policies itself, but also the personalities surrounding the policies, which sometimes is just as important. So if you ever have any questions, you ever want to reach out, it's something that catches your eye, something that you think that needs to be addressed or discussed, we are more than happy to make that accommodation.
One question from Cheryl: is there any advocacy action you would suggest we could take at this time? So
I have to be very careful in how I display this. the Cancer Council cannot directly advocate. We cannot contact legislators. We cannot, even something so much as an op-ed would be a little bit tricky. But as if you were as individuals or as part of your own organizations wanted to advocate, I think there's a lot to be said for the crisis that you have, or the rise in some of the concerns surrounding e-cigarettes and vaping. I think that's a big concern. Any of the bills that we've mentioned in our stuff, if you want to reach out and contact your legislators, contact members of the various health committees or committees of jurisdiction within the Assembly Legislature, that's one of the best things that you could probably do. I know that Senator Baldwin has always had an open ear on healthcare stuff. She's been very good to work with, at the federal level. Same for Representative Gallagher, Representative Kind. They've been very good. I know there's a lot of good folks, over in the state legislature that have issues on this. So, issues that are very near and dear to them. I know Representative Nygren's been, on healthcare stuff's been, pretty good on a lot of issues. So, that's and so things like health can be bipartisan, and I want to point that out and make sure that's not just one side or the other. So don't neglect both parties, because with things like vaping, everyone's got kids and they're all concerned, and that cuts across party lines pretty good.
Okay. So move on to the next question. Like I mentioned, for the policy committee and the staff, we very much value the input of Wisconsin Cancer Council members. And at this time, I'd like to ask, which policy issues are important to you and your organization? If you'd like to, again, either unmute your line or just type them into the chat box. Okay, thank you, Beth. She gave a link to ACS, Advocacy Arm. Misuse of alcohol and tobacco use from Betsy. Okay, any others? Cost of cancer treatment to the patient from Dave, thank you. And Jamie mentioned WPHA and WALDEB. Okay, move on. So I mentioned issue briefs, and I'm wondering what other types of resources would be helpful to you and your organization specific to policy and cancer.
And I'll just supplement Amy's question. These issue briefs are things that a lot of folks use to make decisions on policy, to inform themselves, and there are things that a lot of us external users look at and trust, because they're we find them valuable and very well put together. So. It's always good to have a deep dive on key critical issues. So if there's something that you think that we need to really take a look at, we're all ears.
Okay. Just want to mention something that earlier this spring, the staff of the Wisconsin Comprehensive Cancer Control Program attended a conference. And a number of the attendees came up and talked to us and shared their stories of bringing our fact sheets, the Wisconsin Cancer Profiles on the county level, and infographics to their local officials. And they found these things to be very helpful in having the discussion on policy work. These are all available on under the Cancer Control Resources tab for the Wisconsin ycancer.org website. Great, thank you, Beth. We're going to wrap up our call, and I just want to thank you for participating. I have one more thing to mention before you hop off, however. Links to the resources will be distributed after the call, and of course, like I said, it's being recorded. Okay, upcoming events. On October 16th and 17th, we have the 2019 Wisconsin Cancer Summit. It'll be in Wisconsin Dells, and the topic is survivorship. You can see where to register at ycancer.org/2019 summit. And then November 14th, we're not doing a webinar in October. We're keeping ourselves quite busy. So on November 14th, we have another webinar on tobacco treatment for cancer patients who smoke, and presented by Allison Gorilla, who is who's the outreach specialist for C-Tree. So thank you so much for participating, and we hope that this was very helpful to you. And take care. Thanks.
Thank you, everybody.